Alrighty, hi, hello, and welcome to the golden age of microsegmentation, a healthcare CISO's journey to securing 100,000 plus devices with identity-based zero trust. That's a big title, big topic. Today's exciting webinar is sponsored by Elisity and produced by Actual Tech Media. My name is Jess Steinbach with Actual Tech Media, a future B2B company. And I'm so excited that I get to be your moderator today because I truly love conversations like this. We're going to zoom in on all of you. We're going to take an in-depth look at some of the biggest challenges facing the healthcare security teams right now. Things like the dramatic rise in ransomware attacks, the mounting cost of breaches, and we're going to really unpack what those numbers mean in the real world, the real world context that you live in, all of the people, all of the important critical life-saving decisions that you are making on a daily basis. And with the help of our expert presenters, we will explore why traditional approaches to segmentation have maybe fallen a little short. Maybe some of you already have a little PTSD just around the word microsegmentation. But we're going to get into how modern microsegmentation is changing the way that healthcare organizations can protect their systems, their devices, and strengthen their defenses in weeks, not years. This is such an important conversation. I can't wait to get started. So before we dive in, I just want to run through a few important housekeeping points, and then we can get this show on the road. We're going to start out with a little bit of a tour. Think of this as your guided tour of your audience console. I'm Jess. I'll be your tour guide, and we're going to walk through the console together. Let's head over to the right here. We've got chat, docs, and Q&A. I want to start out in the chat tab. That is my favorite tab. I love that tab because that's where we all get to connect with each other. So I see you, Paulino from Canada. I love it. Canada, nice to see you. Nick, Adam, Clayton, great to see you. Yep, we do. We like you, Texans, Clayton. Jason, hey, Jason, I'm excited to see you again. Awesome. Deepak, we've got you. I think I saw Gilbert and Matthew and Katrina. Yeah, okay. Rob, hey. All right. Well, good to see all of you. Keep those highs and hellos coming as we go through our session today. We absolutely want to see those. We also want you to share ideas, thoughts, general wonderings, things that are coming up for you, things that are resonating with you. Make sure that you've got that in the chat there. Share that with the other members of the community. All right, Ken was clearly in an earlier webinar. We were talking about Taco Bell. I'm glad that you went and got some Taco Bell, Ken. An unexpected plug for where to go for lunch. Everyone go get tacos from your vendor of choice. All right, so we've got a lot of important conversations happening today already, and they're happening in that chat tab. All right, so that's where we want to see you all interacting with each other. But if you take two little hops over there to the Q&A tab, that's where you get to ask questions directly of our presenters. Now they're going to do their best to get to all the questions today, either in live chat or in our Q&A at the end. But if we miss you in our Q&A with our speakers, we are going to send you an email and follow up, so you will get an answer back. Neil, I like it with the Minnesotan there. Hey, from Minnesota. That's Neil, that was my best Minnesotan accent. I don't know. You tell me how I'm doing over here. All right, so chat, docs, and Q&A. Q&A, we're getting those questions in directly to our speakers. The docs tab, full of cool resources, takeaways. Make sure you spend some time exploring. There we go. That's done and ready. A couple more things about the console. One, we've got closed captioning available. So if you would like to turn on that closed captioning, if that would help enhance your webinar today, make sure you've got that on. Two, I want to mention that browser refresh and light mode in your console are two ways that you can deal with any tech issues that come up today. If the browser refresh or the light mode are not working for you, we have the wonderful Deanna here with us in the background today, and she is making sure that this ship stays sailing smoothly. So you can always post in the chat if you need a hand, or if you just want to say hi to Deanna. She's fabulous, so you can post there for her. All right, last but not least, we do have a $250 Amazon gift card that we will be giving away at the end of our webinar. Now, you do need to be here live and present with us throughout the webinar in order to qualify to win that prize. If you're not sure about the full terms and conditions for that prize winner, you can head on over to the docs tab and find those there. I love that. Andrew's shouting out to Deanna already. Hey, Deanna. The folks in the back end, they never get the appreciation, but Deanna does great work. So hi, Deanna, we love you. All right, let's introduce, speaking of people that we love and are amazing, let's get our wonderful speakers on out here with me because we have a rock star crew here with us, and this is going to be such an interesting conversation. All right, so I'm very excited to introduce you all to our expert presenters here with us today, James Winebrenner, CEO at Elisity, Aaron Weismann, CISO at Mainline Health, and Mohammad Waqas, CTO Healthcare at Armis. How is that for a rock star crew, right? We are going to be in for quite the session. Let's kick things off here. Just a moment. All right. Well, we've got our rock star crew on out here with us, and we are ready to jump into this conversation. I am so excited to get into this with all of you today, and I know that we have a lot of good things in store. We just kind of went through and went into names and titles, but there's so much more that each of you is bringing to this conversation. So I'd love to take a second here, and maybe we can ask James, and then Aaron, and then Mo, if we could ask the three of you to introduce yourselves and tell the audience a little bit about the perspective that you're bringing to this conversation today. James?
Thanks, Jess. It's great to be here with Aaron and with Mo. I'm James Winebrenner. I'm the CEO of Elisity, and it's been amazing to work to address some of these challenges, frankly, in a very new way. I've spent 25 years of my career at the intersection of cybersecurity and infrastructure, starting back at Checkpoint in the late 90s and a couple of tours at Cisco. And for the last couple decades, we've been doing things the same way, and expecting different results. And we are very, very excited at Elicity to be bringing a level of innovation to this challenge, and to partner with folks like Armis, and work with great customers like Aaron.
Love it. Aaron?
Yeah, so Aaron Weismann, I'm the CISO at Mainline Health. I've been there a little over 5 years, was previously at the Commonwealth of Massachusetts. Um, really excited to have solid partnerships here to be able to solve issues that we have with unmanageable devices and being able to secure our network. Big problem in healthcare, so very excited to be here talking about it today.
All right, Mo, you're our grand finale.
Well, I'm the CTO of Healthcare at Armis, so I lead globally our medical device security and healthcare strategy. I'm very fortunate to be able to have conversations globally with CISOs of small, large, global healthcare systems. So happy to plug in that perspective in terms of what we're seeing across the board with healthcare. And always love having conversations with great partners and customers like Aaron and James. And just a little bit about me. I've worked directly for a healthcare system. Kind of starting in the trenches as a security analyst and working my way up to strategy and governance. So I think there's a lot of unique perspectives when we're talking about segmentation in the healthcare vertical that folks can definitely draw from when we're talking to Aaron and his team.
There's kind of two key stories that I heard there that I'm really excited about. One is this idea of not doing things the same way we've always done them, and really, I love that the what's the definition of insanity, and doing the same thing over and over again and expecting that different result. And I feel like James, you're going to bring that home for us today and how we can do things a little bit differently. But I'm also really enjoying this sort of opportunity to learn from the three of you who have been in the trenches, in the thick of it, and then also bringing that strategic lens and kind of looking for that decision maker and the ROIs and the important things that come into these decisions. So I think that we're going to get a really interesting perspective today. James, you know what? I'm gonna ask you to get into challenges in just a second, but I want to start with a little bit more optimistic note. Can you tell me one thing that you're excited for the audience to hear today?
I'm very excited for the audience to hear the realities of how quickly outcomes can actually be achieved here. I think one of the consistent themes that we've seen is people have shied away from dealing with this problem because they frankly either failed themselves multiple times or they've watched other people fail, and they've said, no, 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 that's a hard thing. We're going to go put that aside. And if everybody can walk away learning a little bit from the experience that Aaron and the team at Mainline have had, I think it can help increase that confidence factor that there is a possibility of actually addressing this challenge in a new way, and making it a success.
Whew. Okay. Well, if that doesn't get you fired up for this webinar, nothing will. I love that, James. Okay, but let's start there. I think that is the place. As much as I hate that we have to start every webinar just like deep in the difficulties, right? And maybe on that more negative side, but there are a lot of challenges that folks are facing, and we have this unique opportunity to sort of learn from lived experience here. So, James, and I think Aaron, you were going to walk us through a little bit of some of the challenges that folks in our audience might be facing right now.
Yeah, and I'll level set on this by saying when we started Elicity, we knew that there was a massive problem with being able to secure, segment, provide least privilege access for unmanaged devices. And actually some of our earliest design partners were in pharmaceutical manufacturing, where they were dealing with plants that were running infrastructure that was 10, 15, 20 years old, and things that previously weren't connected to the IT network that were being connected, and then all of a sudden you had devices that you couldn't manage, like a modern operating system, a modern laptop, etc. Can't install an EDR, can't go through a normal sort of patching exercise. So we really kind of cut our teeth in this world of unmanaged devices. And in 2021 is when we first started working with a couple of clinical healthcare customers that said, "Hey, we're looking at what you guys are doing in pharma. We have the same challenge, except it's in the hospital where we have managed IT, unmanaged. We have bring your own devices from guests. We have things that are regulated at the FDA level. Again, we can't patch, we can't run agents, etc. But we also can't have any downtime." And so I learned a lot going through that exercise of working with some of those folks. And Aaron, I know when we first met summer 2 years ago, you were very, very clear on the kind of scope of this problem, and how you were thinking about it at Mainline. I would love for you to kind of share the firsthand perspective as a CISO accountable for this, and then maybe Mo, you can actually kind of come in and provide a little bit of the global view, right? We have very, very large hospital systems that are dealing with this, and we have very, very small regional clinics that are dealing with this, but the problem remains the same.
Yeah, no, and we had an acute problem, right? Because our network was relatively flat. We had a lot of these connected medical IoT and IoT devices, really can't do anything to the devices, right? They lose FDA certification if we make modifications to them. Obviously, a difficult problem, but they're all mini computers. They're all jumping off points for an attack. And so we deployed Armis, gosh, about 4 years ago now. And prior to that, we had a real big observability problem. And so Armis helped us quantify what was on our network, where everything was, what it was, and what the vulnerabilities were. And the vulnerabilities were significant. So we had this imperative to fix it. We had gone down sort of a traditional network segmentation route that had not panned out successfully. And so when we connected with you all, James, as you highlighted, it was a really compelling solution for a very serious problem that we had. And, so far it's been working fantastically. And we've been able to at least mitigate the scope, breadth, and impact of that problem for our environment.
Yeah, and I think from just a global perspective, it's echoing what Aaron had just mentioned yourself, James, as well. I think there's a little bit of a paradox when it comes to segmentation. First of all, segmentation I think is probably one of, if not the most complex project for a healthcare organization to undergo, just because you're going from a flat network that existed for 20 plus years, and now you're having to figure out, what do I have? What is it doing? How do I even build the segmentation policies and things of that nature? But very quickly, whether you're a small organization or a larger organization, it's very costly. It can take years. You start losing resources. You're spending hundreds of thousands, if not millions of dollars. And you know what you ended up doing after 2 years is you segmented the enterprise devices you already knew about. And you really haven't moved that needle. So those are the same challenges that we're hearing across, but that money factor as well, after 2 years, when that well dries up, then you're no better off than when you had initially started.
And I guess just Aaron, you laid it out perfectly in terms of the first challenge was observability and visibility, and like what is the scope? Mo, how do you see where is sort of the industry on this journey, if you will, of ignorance is bliss. I know I have a problem. I just don't know the scale or the scope of it, versus, wow, we've kind of taken the first step towards understanding better what is running in the environment. Now we're in this oh my God, what do I do about it? Kind of problem. Where do you feel like the industry is?
So I've spoken with customers in the last year or two, or prospects as well, where they're operating on both extremes. I think the most shocking thing for me was, understandably to an extent, where the CISO said, "I'd rather not know about it because then I'm liable." Right? When they were just not ready to take on what the visibility might lead to. But I feel like in the last maybe 2 to 3 years ago, it was a lot more, hey, we have no idea what's on our network. We need that visibility. So, of course, Armis coming in, we provide that holistic visibility. I think in the last year, possibly two, it's now much more, I like to call it the actionability phase, where it's, we understand the risks on our environment. Now we need to understand what's the most optimal way to reduce it. Because of course, as mentioned, FDA certified devices can't really do much to it. There might be some hardening. So how do we get the biggest return for the resources that we're going to put into this, personnel resources, etc. And segmentation often becomes the answer to what's that underlying security control that'll help address a lot of this. It's just the to get to that level is, I think, where that the biggest incline is on that hill for organizations to overcome.
Aaron, you mentioned that you guys kind of knew that segmentation was the right control to address some of this problem, but that you were running into some challenges getting it effectively implemented. Can you maybe go one level deeper in terms of what did that really look like? Dealing with the operational complexities of multiple hospitals. Again, segmentation is a very well understood control. I think people get it. Even people that have nothing to do with IT, if they've ever looked at a submarine, they know, hey, it'd be a great idea to be able to kind of close this section off if there's a leak. But why is it so challenging, and what was that kind of lived experience for you at Mainline?
Yeah, and you hit the nail on the head with conceptually, it's very straightforward, right? Because the architecture is just we need to partition our environment. When you get to re-architecting a network for multiple locations that can sustain zero downtime effectively, and you lack the talent internally to be able to do that because we didn't have staff specifically trained on our NAC solution at the time, that becomes a set of problems that quickly become insurmountable, right? And that's sort of what we faced. We had hardware issues, we had talent issues, and those are all fixable, and we have since fixed them, but it has taken years, right? And so, with what I like about this solution, right, with Elisity specifically, is the lack of overhead, and the lack of network re-architecture, right? The issues that we faced with a more traditional NAC solution, we didn't have here, and it has driven better hygiene across the organization. So we've seen other benefits as a result of that. And that's one of the things I really liked about it. But again, if you look at sort of where we were with the challenges that we had, um, very, very difficult to be able to drive forward that kind of project, you know, without throwing a ton of money at it and a ton of resources that we didn't have.
Yeah, I think again, it's conceptually easy to understand, and then when you actually look at the challenges associated with implementing that, even in a network where there is the ability to have more frequent change windows, et cetera, it's a tremendous amount of disruption. I had one infrastructure leader who said, uh, trying to do this level of segmentation in the local area network is like, taking pickaxes and shovels and, carving the network up and then manually figuring out what has to go kind of map where. And, I think one of the things that we saw, as the problem that, had, if we could kind of rethink the approach, was if we were starting with the underlying network, starting with having to replumb the network just to get to the place where we could implement that segmentation control or that least privilege access policy, that was the non-starter. We, as I mentioned, we worked with a big pharma that was trying to do this level of segmentation across their manufacturing environment. They had no problem getting budget approved. Over $200 million approved to go do this. But it was a 6-year, 3,500 change control window plan to be able to go get to the place where they could effectively implement policy. And the CISO that we were working with on that said, if that was the only way to do this, I will have been replaced 3 times by the time the project is done. So we knew that we needed to kind of decouple the ability to provide this level of control and least privilege access or segmentation policy for devices without requiring us to replumb the network. I think one of the things that I learned that was very interesting, we take for granted sort of modern operating systems, modern TCP/IP stacks, wireless roaming, things that we, sort of live in this world of being able to just walk around, and all of this is happening in the background. That's simply not the case with a lot of these devices. And Aaron, maybe you could provide just again a couple more anecdotes on the challenges of dealing with specifically with medical devices that are FDA regulated. We can't simply just change an IP in some cases without having a tech, right, come out from the manufacturer.
Yeah, and we actually experienced that acutely when we went through an EKG machine upgrade. Gosh, I want to say 2 or 3 years ago. Where we had to effectively replace a lot of NIC cards on those and then reconfigure those devices. And that required manual touch on every single EKG machine that we had across the enterprise, which is a significant work effort. I mean, it took the better part of 6 months for our biomed team to do that. And if we think about that, if we think about infusion pumps, if we think about beds, if we think about all of these network connected things that, you know, require that sort of level of manual touch in order to manage, that becomes insurmountable over time, right? And that's part of the contribution to the NAC project, right? One of the many things that made sort of the entire thing insurmountably difficult at the time. Again, we just don't have the resources to be able to manage those heavy touch items all at the same time for, one very significant work effort.
Yeah, and this I think as we kind of think about the approach to trying to solve this problem again in a different way, that it became really important for us to look at being able to meet customers where they are, and that for us means really two things. One is we heard consistently, if this requires a heavy lift, hardware refresh, this is a non-starter. In many cases, it's just the budget isn't there to be able to go through and refresh the entire network all at once. And secondly, again, from an architecture perspective, Aaron, and you talked about this, the challenges of going and trying to add VLANs, move things around, re-IP is very different in an unmanaged environment, in a clinical environment, than it is in a traditional, enterprise carpeted space environment. So, one of the things that we looked at, and I'd love to get your perspective on sort of the reality of how this played out, but we've been very focused on very quick time to value. So we're delivering this capability via the cloud. We can ramp very quickly and onboard customers' existing infrastructure without requiring deploying hardware, without requiring changes to the network configuration. And we can bring that infrastructure into Elisity and immediately have that visibility into what's running and start to think about how do the segmentation policies begin to run out. So Aaron, I remember you and I on a Zoom call. It was like 6:30 in the morning. I was in Las Vegas for Black Hat. You had just finished the debrief the night before, the executive readout from the proof of value that the teams did. Talk to me a little bit about what that kind of time to value conversation was like with you and your team.
Very quick. I think your engineering team had us up and running within about 3 hours, and by the next day, we were setting policies for our IT offices. And we were able to see immediately the impacts of that, right? But one specific test we had was blocking the ability for one of our staff to print, right? Completely severing that ability for him to reach any printer across the enterprise, and that worked fantastically. So, the proof of value very quickly observable, trying to figure out, okay, what does that then look like from a deployment perspective? Because, it's almost too good to be true, right? Being able to say, hey, in a couple of hours, we're going to be able to create, the ability for you to segment your networks very effectively. When you deploy that across an organization, it's like, okay, well, this might take months, but it's going to be very quick. We're going to have very quick, sort of results as a result of that. This can't possibly be that, right? And in fact it was and is. So
Yeah, and again, I think that is the biggest challenge that we see is the people are like, it sounds too good to be true, and
yeah.
so it is something they have to see for themselves. Mo, maybe if again, you mentioned kind of where the industry is on this continuum or this journey of really just trying to get their arms around the problem. What is what is running? And again, we're talking about not just the kind of med tech FDA regulated devices, but every one of these hospitals, every one of these clinics has IP video cameras. They have badge readers. They have building automation and control systems. There's so much infrastructure running that is not part of the managed IT stack, and yet the Aaron and his peers are responsible for the risk associated with this, right? So, I think we've got a great partnership. Obviously, lots of customers like Mainline, where this is very much a better together story. But maybe kind of talk about that paralysis that you've seen of when people sort of get the visibility the first time. Where do I start? What do I do? And how are they sort of thinking through this?
Yeah, absolutely. And I think if we were to rewind for a second, I want to double click on something you said because what I like to say is healthcare vertical or healthcare delivery organization has probably the most diverse device ecosystem that I've seen across any industry. So of course, OT and all these different types of sub industries absolutely have their specialized equipment. But to your point, the role that building management systems play in healthcare, the role that physical security plays not only for badge reading and things like that to keep HR departments and IT departments locked down, but also to keep patients safe. So a lot of these, including the third party risk, very quickly becomes part of the conversation that we start providing this level of visibility. Now, the other part that I'll mention real quick is a medical device. I think we don't view medical devices and enterprise devices equally important. Medical devices might have a little bit of a leg up on enterprise, but also I like to say that not all medical devices are created equal either. That same infusion pump in a day clinic versus an infusion pump of the same make and model in an emergency 24/7 acute care center, two completely different contexts, probably different policies that need to be applied, two different approaches to even onboard that into your segmentation program, right? So I think the different layers of visibility when you're looking at, well, first of all, what do I have? Hey, you had 20,000 IT assets, but really you have 100,000 plus assets in general on your network. That number can be extremely overwhelming. Then you look at what are those devices doing? What are the applications running? What are the OSs? How many of them are outdated? What are then the vulnerabilities that exist? I didn't even know that my MRI is calling out to the internet every day at 2 a.m. Or I'm seeing blocked external attempts to try and connect to my internal infrastructure, or that my vendors are coming and plugging in and connecting to devices without me even knowing, or the fact that, you know what, TeamViewer is installed across 20% of my medical assets just as a standard image that a vendor might use, right? So it's all these different things that are just coming at you. Where do I even start? So part of the approach that we take with Armis is, after providing that complete visibility, we start prioritizing what's the most important when it comes to the types of devices, the context of that device in your environment, the vulnerabilities that exist within that. And by sharing that data with platforms, specifically with Elisity, I think we're helping organizations also help achieve that segmentation in a much more efficient manner, helping them prioritize, this is the collection of assets and attributes to look at to help reduce your attack surface at most upfront, as opposed to healthcare organizations always focusing on that long tail and trying to figure out how to perfect securing those two or three devices and really not making the progress that they're looking and hoping to make.
No, I mean, I think you framed that perfectly, and you used two words that I think have really become very, very important to the conversations that we're having with the security teams around how they want to manage policy. And that is that they need to know everything that's running, all of the assets, because it doesn't matter if we can only provide segmentation policy for the things that have a .1x supplicant or the things that I have an EDR on. We and Aaron, you're living this every day, right? We have to make sure that we've got the policy addressing all of those devices. But the second is the context matters. We can't just say there is a policy for an infusion pump, because to your point, Mo, the use case is very, very different. So being able to decouple policy from the rigidity and the complexity of the underlying network constructs was very, very, very important. And this is the capability that we've delivered in the Elicity platform, so that the security team can actually just manage policy around the identity of an asset, of device or a user or workload, but then more importantly, the context within which that asset exists. And it doesn't matter what VLAN it's on. It doesn't matter what the IP address is. In fact, it doesn't matter if any of the underlying network things change, because the policy is tied to the identity and the context of that device. And that makes it far, far, far easier to effectively manage that and to prioritize the management of that relative to the risk.
And
So,
I think that
Aaron,
can
let's.
just,
Oh, go ahead.
I was just going to say, if I can just add one more point to that, I think it's also important to look at segmentation. I'm sure you both are much more aware of this than I, but segmentation is not a one and done, right? Segmentation, it's not about just onboarding the assets. It's, to that point on the previous slide, where it's dynamic policy enforcement, right? So it's, when Armis comes in, it's one thing about establishing that baseline asset inventory to help enforce that, but then that continuous evaluation, that continuous policy enforcement, so that if a device does move out of that operating context that we were just talking about, if that iPad that's used for patient registration now all of a sudden changes its behavior, the ability for Elisity and Armis to work together to be able to quickly recognize that and then quickly determine which is the most appropriate policy to now update on this device. I think that's the two pieces of the puzzle for segmentation. I feel like a lot of folks are always focused on the initial one, but the second one is also just as important. And when we're coming in with an established network segmentation program, that's something that if they quickly find out their programs aren't necessarily set up to be able to dynamically adapt.
It's a great point, and I think we talk about this in the context of the drift, right? When if everything is being tied to the underlying network, those things change, and so 6 months later, the CISOs have very different perspective on their confidence in how effective those policies are. So, Aaron, maybe kind of again, we're almost 2 years into this journey, and I would love it if you could share a little bit about kind of the reality of what that's like. This you've been living with this now in a different context, and maybe share with the audience a little bit of what that experience has been like, sort of on the other side of being able to implement a more dynamic segmentation, least privilege access policy.
Yeah, from a security standpoint, it's fantastic, right? And I think it boils down to that, like being able to confidently be able to tell my boss, my executive leadership, my board, hey, in fact, we have a segmented network. We are protecting against certain forms of attack. As a result of that, we're limiting the blast radius of other attacks. That is that provides a lot of confidence for people, right? And it provides, I think people are irrationally afraid of cyber attacks just because of what they see in the news. And maybe it's not irrational. Maybe they should be that afraid of it. But, we are able to reduce sort of the fear around what an impact of a cyber attack would have for our organization as a result of that. Right. And you can't put a dollar value on that, in my opinion. As far as sort of the administrative overhead, right? I mean, it's been incredibly straightforward. And we've been able to drive better hygiene as a result of that. One of the issues we discovered as a result of the rollout is because we have these 24/7 sites that really can't accept downtimes. We hadn't patched some network switches in almost 5 years, right? Which is not something we want to see. And as a result of the Elisity deployment, we've been able to increase that to an annual, if not greater cadence of updating our switches, deploying updates, and making sure that the environment is operating as it should, which has been a huge boon for our network team who's been trying to get this done for years, right? So it's one of those things where, yeah, we have great security as a result of this, but we're also driving other improvements in the organization as a result of the Elisity deployment and the Armis deployment as well. I've similar stories there.
Yeah, and we talked about the fact that this is a pervasive problem. Unfortunately, many of the healthcare customers that we're working with, they're acutely aware of how real this risk is. It's not existential because they had to deal with ransomware threat actor activity, kind of during COVID and coming out of the COVID time period. And so, many are frankly having tough conversations with their cyber risk insurers, with the board, around the need from a financial perspective to get these controls in place. Do we want to give another more money to the insurers, or do we want to actually invest and reduce the risk? So I think it's really important, Aaron, to be able to kind of share your story more broadly. We're very excited to be able to do that here today. But it's also been really great and to see the recognition that the mainline team has received, not just for the fact that you guys have had this success, but because it's really raised the visibility of what is possible. And I know, in each of these cases where you guys have been able to share about the success of this project, there's 20, 30, 40 people that are a year, 2 years, 3 years behind you saying, oh my gosh, wow, this is really possible. What can we learn from mainline? So maybe just share a little bit about what that experience has been over the last year as you guys have been sort of on tour with this, in the healthcare ecosystem.
Yeah, no, thank you. And it's a result of the strong partnerships we have with Armis and Elicity, and quite frankly, this wouldn't be possible without that, and without the feedback loop that we have for being able to drive changes in both platforms, right? So I'm incredibly grateful for that. Um, and a lot of what we're trying to do is addressing those ransomware situations, right? How do we mitigate the blast radius? how do we keep our clinicians up and running, being able to see the electronic medical record for our, patients, and have that care continuity and minimize patient safety events. And so one of the initiatives that Elisity and Armis have helped us facilitate is being able to provide a downtime network, so we're able to see what goes where and how it operates. Mo, you were talking about the context of devices. James, you had mentioned that as well. By giving us the ability to see that and the ability to experience that, we're able to say, okay, here's what a ransomware attack is going to look like for us. Here's what we need to keep up where and when. And that's been a huge boon for us, and we're in the midst of deploying that. But our goal is to make sure the organization has some level of technology access, some level of electronic medical record access, so that we're not completely dark and on paper. We've talked to other health systems that have had that problem, James, to your point. Really terrible situation to be in. Nobody ever wants to be in that situation. So we're trying to avoid it as much as possible. Another initiative that, again, deals with device context is risk-based segmentation. So being able to provision devices into different segments based on the level of risk we're seeing out of Armis. And inherently risky and incredibly risky devices being put into a sandbox effectively. They get network, public internet access, and that's it. Prior to the deployment of Elisity, prior to the deployment of Armis, no possibility of doing that. So we're very excited about that capability. We're very excited that it's working in production now. And knock on wood, it's able to help us mitigate really severe threats for very risky devices.
Yeah, Aaron, I mean, you're hitting on, I think, the the part that's so incredible is, the hard work that in some cases, again, customers were just taking 2 or 3 years to try and get to the place that we were able to get to together in frankly in a few months. And so we've now been able to take the next step and start to get even more specific in terms of some of those policies around some of the riskiest devices, and start to actually think about prioritizing investment from a network lifecycle management perspective, that's actually prioritized based on risk reduction. Instead of saying, hey, we're gonna just go peanut butter refresh across the environment, we can actually make some risk-based decisions on where that investment is going to be. So it's been a great collaboration from that standpoint with the team. I know providing a tremendous amount of feedback on what you guys are looking for in the roadmap, both with us and with Armis. And again, I think the fact that we were able to kind of make so much progress early on allowed everybody to get to a confidence level to say, hey, let's think about how we can go and take the next step. So I wanna maybe give just a couple minutes, for Mo, you to kind of provide your perspective on what's next. The sort of the what do we think is going to happen over the next year or two, in this space. And Aaron, again, you've got sort of a unique perspective with your peer group and all of the work that you've done to kind of try and share some of these best practices back, and kind of what do you think the next steps look like. And while you're providing sort of that perspective, I do want to just let the audience know, we are happy to share more detail to go into as deep technical depth on any of what of the capabilities the Elicity platform has delivered for mainline. I'm glad that we're able to talk about the outcome. We know that you need to understand the how, and we're happy to do that. So I'm gonna leave this up here in the background, but maybe Mo, we'll start with you on kind of where do you see the next 12 to 18 months, in terms of this risk reduction, and then Aaron, again, your perspective as well.
So, couple thoughts here. Number one, the risk is going to increase exponentially. I'm going to be the guy to drop AI into this conversation very briefly, allowing attackers to get much faster at doing what they need to do. And that's just going to drive the need for action, right? It's no longer about the concept of network segmentation. It's going to be about we need an agile approach to network segmentation, which is where, of course, Elicity is just leading the industry. I think the other part, if an advice, if I will, to CISOs, it's develop your strategy. Network segmentation is a concept. It can play into a strategy, but I recall very clearly when I was speaking to a healthcare system CISO in Florida, and we were going back and forth about segmentation. I just kind of paused because they were going in multiple directions. I said, "What's your strategy for segmentation? You can segment a network in multiple different ways." And he kind of just took a step back and said, you know what, we haven't had these conversations. All we've done is we said, we need to do segmentation, and you're biting off more than you can chew. So I think from a strategy perspective, healthcare organizations really need to get ahead of how they need their environments to look to prevent or to reduce the risk against this increasingly expedited attack landscape that they're coming up against with the advent of AI being incorporated into all these different attack patterns now.
Yeah, and since you brought it up, Mo, Aaron, as you're thinking about kind of what's next for mainline, how are you thinking about AI? And I'll ask you to kind of present your perspective from the acceleration on the attack side, but how are you thinking about it, from being able to get better at prevention and security as well?
Yeah, I mean, you can't have a security conversation without AI, right? Or any technology conversation. It's a force multiplier for pretty much whatever you're applying it to. And I think in the security space, we're already seeing an uptick in threats as a result of that. Um, 6 months ago, I was pretty dismissive of that, but I've since, come to my senses. And I think the difficulty we're gonna see is, we're not upstaffing at the same rate that AI is producing content, right? We just can't do that. Um, because we don't have the infinite staffing pools to draw from, right? Or an infinite budget to draw from. And really that's what it seems like we'd need. So looking at automation, looking at better ways to interface the tools we already have and make them interoperate better to provide, more comprehensive security, I think is something we're absolutely looking at. Um, my biggest concern in the space now is social engineering because we don't have automation in that space, right? It's so human focused, and I don't want to take the focus off of network segmentation, but this is something I don't have to worry about because I feel like it's working very well, and that scaling is already happening. It's the areas where that scaling isn't happening that I'm really really concerned about.
Yeah, and I think that ties absolutely back to the fact that least privilege is a pillar of zero trust for a reason, and it's tied to starting with identity, and that identity could be a device, but it's also a user, and understanding that identity and context across the user base, essentially assumes the worst from a human identity compromise or social engineering perspective. So I think that's actually a great segue, Aaron. I think for us, being able to demonstrate the capability to get to this level of segmentation very very quickly, to actually have a massive risk reduction without having to go change a lot in the underlying infrastructure really does allow us then to have the strategy conversation mode that you're referring to, which is what's next. We might start with a very very coarse grain. Hey, let's take all of my FDA regulated med tech devices and segment them from everything else that's unmanaged. But then how do I go start having that risk based conversation around what is the next degree of policy that I need to have in place? And obviously AI is helping us to make better recommendations on how that kind of risk based approach to that policy can be implemented. And so we're excited about the capabilities that we've been developing into the platform around that. And Aaron, again, certainly the work that we've been able to do with you and the team has been helpful on influencing that roadmap. So I'm very very grateful for the time today, guys. I think I saw just that we've got a few questions from the audience, so maybe we can take a couple of those and address them. And again, for anybody that's watching, we would love to be able to go and provide a live demo of the capability that we've been talking about here today, and go kind of deep into the architecture. How do we take that Armis data into our identity graph? How do we effectively build and deploy that policy in minutes? I promise you it's worth 45 minutes of your time to go through that demo. So, Jess, what are the burning questions from our audience?
We got lots. We got lots. You guys are striking chords all over the place. That was a fascinating conversation. I want to thank all three of you for sitting. I like when we get to kind of go along with where you all are passionate and excited to explore. I felt like I was just kind of having coffee with all three of you, and we were just chit chatting about big important things. And I do want to call that out. One of the things that really hit home for me as you guys were going through this is, and you said this early on, it's not just doing things; it's doing things the best, doing things optimally, because there's no option to have things not work, when literal lives are at stake. And the complexity of these environments we can start to think about it in data sets and compliance and numbers, and at its core it's humans and lives. And so I think you guys really took us on quite a journey today, and I want to thank you for that. We do have a lot of audience questions, so let's start with this one. Ooh, I like this one. Okay, James, I think I'm going to kick this to your special guest here. How did you convince the board that this was worth it? What metrics helped you convince them? Mo and Aaron, do you guys want to take that one on for me?
Yeah, so at least in our case, victim of our own success with Armis, by seeing what was on the network and how many vulnerabilities we had, as an organization, it's one of the few things the board has asked for by name. And I was pretty much given the command, hey, you have to figure out network segmentation, right? Someone had heard it somewhere based on conversations they probably had around vulnerabilities with their peers or at their own organization. And so pretty quickly had to come up with a plan and a solution for that, right?
Yeah, I'll echo the CISOs that I speak with globally. It's exactly that. It's taking the data from Armis, reporting it up to the board, and the question very quickly becomes, okay, what's next? What are we doing about this? How are we reducing the risk? Right. So I think that's the exact metric. And then to James and Aaron's point is, as you're making that progress, the board remains interested in seeing how much has my risk reduced by, so that escalated approach to not only showing that risk, but also how we're planning on reducing and how quickly we have reduced it is something that gets board members' attention very, very quickly.
Ooh, I love that. James, is there anything that you'd want to speak to there in terms of the reporting side of things?
I would just say, yeah, I think that even more so than in some of the other verticals and industries that we work with, I think unfortunately, because of the amount of ransomware or threat actor activity that has been targeted into the clinical health environment in the last 4 or 5 years, these boards are painfully aware of the risk, and we have seen regulatory frameworks, HHS 405D, that have specifically called out the need to do segmentation for clinical devices. So in some ways, it's an easier conversation because no pun intended, the pain is more acute in this particular sector. But I think, Mo, you're spot on. Being able to show, not just that, hey, we've got our arms around the visibility, we understand the risk. Now we've actually taken steps to mitigate the risk. And hey, what's that ongoing capability? How confident are we in that? Again, back to not doing a project once and then 6 months later, Aaron, you're sitting there saying, I really don't have the confidence that the policies are still there. Being able to really go back and demonstrate that in a repeatable manner is I think helping to build additional confidence in that CISO board level conversation.
I will say that's one of the benefits of having a concept that is easy to grasp, even from the outside, because even if you have a non-technical board or decision makers that you're trying to bring in, to the conversation, you can explain the submarine without having to get into the weeds of microsegmentation. And so being asked for this, it's like AI is something that you don't have to fight to implement anymore. It's you're getting pushed to implement that. So I think that's a nice thing that we've now got some ideas for the audience here of what they can bring back to sort of validate this, the submarine. And keep that moving forward. I want to bring this question up too, because we do get a lot of questions about cyber insurance. That is a hot topic for folks in the audience. So question here, did your cyber insurance rates actually go down? And I don't know if you guys are comfortable sharing this, but they're asking if you could share by how much. How much did you see that reduction?
Yeah, so I'm unwilling to share exact numbers, but we saw over 10% reduction in our cyber insurance premiums. And, a lot of it's attributable to this. There are other hygiene efforts going on, obviously, that contributed to that as well. But I mean, it's a significant savings, right?
Yeah.
And being able to demonstrate that level of hygiene to our cyber insurer, obviously giving them great confidence as well.
Mo
And
or
I'll
James,
just
anything?
add,
Yeah, go ahead, James.
anecdotally, I think we've been working with one of the largest insurance brokers globally, and they are taking a very data-driven approach to this, where they're actually correlating the deployment of controls, not just Elicity, but other controls in the cyberspace, correlating it directly to lost data in their customer base, and then going back and fighting on behalf of their customers with the underwriters to say, this is what we're seeing in terms of real risk reduction. And so, we're seeing, in some cases, unfortunately, we're seeing, premiums double and triple when there's not efforts being taken to meaningfully increase the efficacy of these controls. And we're very pleased to be participating in this. They're calling it their cyber marketplace, where they can actually, kind of programmatically go help customers, have that conversation to demonstrate the efficacy of the control and the commensurate premium reduction.
I'm gonna keep things moving because we're nearing the end of time, and I want to try to sneak in a few other questions. But of course, we were talking a little bit earlier about the human element of all of this, and by that, I don't just mean our internal teams, although of course that, but I mean the folks that are involved and in these healthcare systems. So speed being really important. One of the questions that came in is, does this add latency to the network? We can't slow down clinical systems.
I'll let Aaron talk about the actual experience, but just architecturally, I do think it's important to call out the fact that one of the key tenets of what Elicity is built is the fact that we are a control plane only technology. We're not changing the data plane. This is really, really important. We don't want to have customers replumb the network in order to be able to get this control in place. So by design, we're not changing how applications or how traffic is routed through the network, and therefore we're not introducing latency into the systems. And we see this, again, this is critically important, especially with some of these much older devices, devices that don't have modern TCP/IP stacks, because they're not as resilient around these changes. So if we try and say, hey, we're going to put a bump in the wire, all of a sudden that bump can cause issues. So that's been part of the architecture from day one, is control plane only and not disrupt the data plane. Aaron, I'll let you kind of talk to the actual experience.
Yeah, no, and I wish we had actually run a study on that to be able to authoritatively, excuse me, say, here's the data, there's no latency, but anecdotally, we've received zero complaints about latency related to Elicity, right? We have other events that create latency issues, but yeah, I mean, since we've deployed Elicity, there's been no increase in complaints around that.
Love hearing that. Okay, I'm going to be a rebel. We're really close to time. I'm going to sneak in an extra question. I'm doing it. All right, we're wondering here, and this is getting again into, I'm sensing from the audience here, there's a lot of that looking for those key metrics and ROIs to bring forward to their organization. So what is the real operational overhead here? How many FTEs are managing this daily?
In our experience, very small. We
Mm.
don't have a dedicated FTE to it. We're spreading it among our network and security teams. I'd say we probably have half an FTE on both teams doing work related to this, related to switch updates, related to general hygiene, etc. Right. So it's the network management overall of the devices and of Elicity, not just, hey, we're looking at Elicity and this is all we're doing all day. Once we got past the policy setting, that has been just very, very um, low overhead. The policy setting itself also low overhead, but my team wanted to get very involved in how we were defining all of that. So more people were involved, but probably didn't need to be.
And again, I think this is part of the architecture, was to really decouple policy from the network, and that allows, frankly, the team that can understand what the policies need to look like, to move very quickly, and not have to become network propeller heads and try and figure out how do we or is this the right VLAN, is this the right IP address. So that in and of itself is reducing some of that overhead. I'll give another, sort of example of this. We have a hospital system customer on the West Coast, pretty large system, 51 hospitals, a couple thousand clinics. They had 16 FTEs that were previously managing their VLAN firewall segmentation alongside a network access control platform. They've been able to reduce 16 to 2, managing policy in an identity-based manner with Elicity. And that's 14 heads that they were able to redeploy for other critical projects, across the organization. So This has been a real key focus of ours is operational simplicity. And again, making sure that kind of the day two is very, very easy to manage.
Boy, imagine, I mean, that's true human impact, but operationally as well. I imagine the projects you could move forward in your organization if all of a sudden you had 14, people available to help. Okay, I am actually going to stop being a rebel, and I will bring things to a close here, which is very sad to say because obviously we could keep this going all day. What I'm going to do is I'm going to reverse the order that we introduced ourselves in. So initially we went James, Aaron, Mo, and now we're going to go Mo, Aaron, James. And James, you're going to be our grand finale for the webinar. I'm going to ask you guys to give me a sort of wrap thought. So the way I'll phrase this is we've learned a lot of things, we've covered a lot of ground, and it could feel overwhelming. So if there was one piece of advice that you wanted to give folks in the audience, a way to get started, what would that one sort of first step or processing and kind of mental mull over that you'd want people to take with them? So Mo, then Aaron, and then James, you're going to bring us home.
Yeah, from my perspective, I'll go back to Armis's core. It's definitely visibility, but one caveat I'll add there is when you do turn on the lights, don't get overwhelmed. Prioritize what's the most critical, whether it's to patient care availability, patient care services. So prioritization is going to be the key of unlocking or translating all that visibility you have in terms of getting to an effective risk reduction prioritized model, if you will.
Love it. All right, Aaron.
Yeah, I'm going to echo the commentary about strategy, previously, right? Build observability, figure out to Mo's point how you're going to draw down on what you find because you're going to find a lot and it is overwhelming at first. Because that's really all you could do.
Very important. Start with that strategy before you jump in, but also jump in. Also keep moving, keep doing things. James, okay, I'm going to make yours a two-parter. You get a bonus for being our grand finale here. I'd love to hear your final thought and kind of your key action step or idea. And then I'd also like you to give us like a good reminder on demos or how we can kind of follow up and get to know you a little bit better. So yeah, that 1-2 punch.
Yeah, so first of all, I'm going to just tie together what Mo and Aaron said. I think this is a strategic conversation. It has to be handled in terms of the overall risk reduction strategy, and it starts with visibility. And I think the one thing that I'll add is the faster the security teams and the network infrastructure teams can actually get together and have this conversation around it being a strategy, the better the outcome will be. I think the challenge that we've seen is typically it's the security team gets visibility. They say, oh my gosh, we got to do something. And immediately they run into a brick wall with, hey, network team, we've got to break the network. We've got to put this control in place, and it creates friction. We are delivering, and this is proof, we're delivering a better capability, but that conversation still has to happen with all of those stakeholders in the room, and they have to get comfortable with the ability to move on that strategy. So I completely agree with the feedback from Mo and Aaron. And I think in terms of next steps on this with any of our audience members, we would love to share more detail around the use case with Mainline. Aaron and his team have been incredibly gracious with kind of opening up that case study, and so we can walk through that in great detail. Please do reach out to us, either the QR code or www.elisity.com, and schedule a demo. And we are happy to go through, again, a use case walkthrough of what we went through together with Mainline Health. We're also happy to go into deep technical detail on the Elicity architecture and how we can take that the visibility that Armis provides and immediately make it actionable. And I promise you that 45 minute, that hour demo is well worth your time.
Well, I think we've proven that today because the hour has just flown by, and here we are at the end of our webinar. Mo, Aaron, James, I want to thank each of you for being here with us, for leading us through this really fascinating and captivating conversation. Lots of great takeaways, both the high level and the action steps. So I know our audience has really enjoyed it as well, and I hope that I'll get to chat with all of you guys again soon.
Thank you so much,
Yeah,
Jess.
sounds
Thanks,
great.
Aaron. Thanks, Mo.
Thank you.
Thank you, everyone.
What a great conversation, a great way to spend an afternoon, morning, evening, wherever you're joining us from in the world. Thanks for that. And I know for a lot of us here, when we have this type of conversation, and there's so much that we cover and a lot that we go through, and immediately you're looking to learn a little bit more. And now James has just given us some great ways that we can jump in and keep this conversation going. But if you're looking for something immediately, I do have to suggest that you head over and spend some time exploring the Docs tab. Get those tabs open, hold on to them. Don't leave us just yet. So open some new tabs. I know it's really easy to just start clicking and off you go. But hold on to those, because there's some really great ways that you can bring this conversation forward in your day. There's a buyer's guide, an integration brief, and a white paper, all very much ways that you can invite other people from your organization to learn a little bit more, and maybe send them the on-demand link so that they can watch. And spend some time with it yourself. You know, I love that that we addressed early on that microsegmentation is something that a lot of people might have their hackles up about if they've been involved in projects before that were really bulky and hard to get through. And there's some really cool innovations and strategies and approaches that we got to hear today that, again, will be outlined in those docs tabs. You can learn a little bit more there. And obviously, yeah, reach out and get to know Elisity a little bit better, because there's just the tip of the iceberg in the conversation today. All right. Well, before we wrap things up, I do also want to say Deanna is about to open up a survey for all of you. So you can take a second now and let us know what you thought. You know, what's your feedback? How did the webinar go for you? We absolutely want to hear from you. And this is not meant to bribe you in any way, shape, or form. But while you're filling out the survey, I will also do the prize giveaway. We have a $250 gift card, Amazon gift card, going to someone who is here live and present at the webinar. I'm a little bit lucky, probably. We're going to send that on over to Nick Zeppa from Washington. Nick Zeppa from Washington. Congratulations to you, Nick. And we will follow up with you after we wrap. I want to say I'm seeing all kinds. Oh, Nick. Hey, Nick. Yay. I see Nick in the chat. That's awesome. I love when we get people that chime in a lot and they're winners. I have nothing to do with choosing the winners. And so I hope that you guys know that I'm not participating in that at all. I am just announcing them. But it always makes me happy when I see your wonderful names there. Congratulations, Nick. We'll be in touch. And thanks to you, Andrew and Gilbert and Rob. Oh, I very much appreciated, Rob. And Jason. All right. Well, I'm loving all the good vibes coming from everyone in the audience today. And I want to pass those good vibes on behalf of the actual Tech Media team. I'll thank Elisity for making this webinar possible, especially to our wonderful speakers, to James, Aaron, and Mohammed. You have given us a lot to think about today. I really appreciate your candor, your openness, and your excitement and passion, and bringing all three of those things together. All right. Well, as always, my biggest high fives, my biggest thank yous, all my shiniest of gold stars go to all of you out there in the audience for taking time out of your day to join us. I know we've gone a bit over, so I'll wrap things up very quickly here, but I really had a good time chatting and exploring some of these more real world examples today with all of you and with the help of our wonderful speakers. And I think these are really exciting opportunities when we come together, when we get real, when we look at the world we live in, and how we kind of can operate within that context. So I'm hoping that you're all feeling a little lit up and ready to continue this conversation moving forward in your days. Most of all, I hope that I get to see you all at a webinar again soon. And until then, have an absolutely beautiful end to your day. Thanks all.